really nervous about this test. Just pick one, you pick for me. Pinky, pinky, ponky. Okay. You got the wrong one. Okay, I'm going to the closet. You ready for me?
Yeah.
Okay.
All right.
So mine is for pain. Okay, I get to go. All right. So when does my timer start? Once I get the patient. Right. Someone did not do what they were supposed to and unplug the machine, right?
Is it just awkward whenever we're doing this?
Yeah.
Sorry. My bad.
Can't help it. Okay, it's all good. It's all good. All right, and I'm going to be doing high volt. Okay. So I need to make sure I've got my right cord. And I'm not for high volt. Let me get out of character where y'all using the high volt cord.
Mm-hmm.
Okay, great. Okay, I just want to make sure I have all my things in check. And you have your electrodes, is that correct?
Sure.
Did Labriska have the large adhesives?
Do you have an emergency number for that?
Wouldn't care. Yes, I'm gonna do it right after I do this.
Okay.
So I'm going to make sure that I have my electrodes. I'm going to do a monopolar setup. I have one active electrode with the dispersive. I have my goniometry to do range of motion pre and post assessment, edema if I need it for circumferential measurements, clean the area, manual muscle testing, sensory testing. Okay, all right. Hi, my name is Tracy Thornton. I'm going to be your student physical therapist assistant today.
Okay.
And could you verify your name and date of birth for me?
Audrey Rogers, 1161.
Very good. That is who you say you are. It's on your bracelet.
Yes, ma'am.
Okay, so Miss Audrey, I see that you tried to get back into tennis and that you're having some pain here on the lateral side of your elbow.
Yes, ma'am.
It says you used to be a competitive tennis player and you've decided to get back into it for some recreation and
Yes,
strengthening? Okay.
Mhm.
So have you ever had electrical stimulation before?
Yes, and the student burned a hole in my hip, so
Okay,
I'm very nervous about it.
Okay, well, I just want to calm your fears because we're not here to burn you.
Okay.
Okay, so the way electrotherapy is intended to work when it's done correctly is it's a low level current and it's intended to work with your body's polarity system to try to bring about some healing effects. Now, because of your acute pain from hurting at playing tennis, you've not been able to really move through the range of motion and you're losing some mobility in that elbow. So today what we want to do is try to decrease that pain and then work through some of your range of motion, okay? Now, when we put the electrodes on, we'll turn it up only to where you're feeling a little bit of tingling or buzz.
Okay.
That should be the maximum feeling that you have.
Okay.
No biting, burning, or anything that you felt the last time you had this done,
Okay.
okay? If you feel uncomfortable at all or start to feel anything like that, you let me know and we will stop the treatment immediately,
Good.
okay?
All right.
But the intent is not to make your pain worse. We're trying to decrease it.
That sounds great.
Okay, so all we want to do is kind of close that pain gate. Your body has a natural mechanism, and to provoke some enkephalin release, you do some immediate pain relief, so then we can start working on some of those exercises and get you back in the game.
Awesome. That
So,
sounds fun.
you feel okay with doing that today?
Yes.
Okay, so I need to make sure that you're a good candidate for this treatment. So to ask you a few questions. Could you be pregnant? Are you currently pregnant? Is that even a possibility?
Oh, no.
Okay,
It'd be immaculate if it was. Immaculate conception.
okay, great. All right. You are the right age for this, I see. So we would want to make sure that you're in the right age frame. Cognitively, you're able to make your own decisions. That's very important for this treatment. We would do it trancerebrally across your heart, or trancerebrally across your brain, or transoracically across your heart to interfere with any of those electrical signals. That's not what we're trying to do here. We're
Okay.
just doing a superficial type of sensory stimulation.
Okay.
All right, so our other contraindications, we're gonna do it in the area of the epicondylitis, and sometimes you could get a little bit of burning, but we're not going into that range, okay? I know you're worried about the hip, so I wanted to kind of assure you we're not turning it up that high.
Okay, great.
Okay.
Perfect.
So then our other contraindications, you haven't had a fracture, so there's no unstable fracture in the area. We're gonna do a sensation test to make sure that your sensory system is intact. Leave anything out? Any blood clots, history of heart issues? Do you have a pacemaker, superficial metal implant, any type of defibrillator?
No, ma'am.
Cancer. Did I get them all? Cancer. Thanks. Any history of cancer?
No, ma'am.
Okay, all right. Sorry, y'all, brain fog still. So once you have cleared all contraindications, she is a good candidate for this. If you don't ask all the contraindications, then you fail the exam because you're putting her at risk, okay? All right, so the next thing we want to do is start your pre-assessments, okay? And that's just to make sure that, first of all, you have good sensation for this type of treatment, and that we do some pre and post measurements to see, are we making a difference with this treatment, okay? So first thing is what we call a dermatome test. We'll get you to take this off, your little necklace here.
Okay.
And since we're doing this left arm, I want to make sure we remove any jewelry in your left upper extremity as well, because that can increase the conduction of the E-stem. Okay. All right. So let's check this area. Okay. And before I do the sensation test, I just want to check the area. I'm going to palpate it, which is just a way to touch observation instead of visual observation. Okay, I'm seeing a little bit of inflammation, so some redness, but no heat, no swelling to the area at all. Okay, and can you bend your elbow for me? Okay, that hurts a little bit.
Yes.
Okay, but you do have some good range. Okay, so here's where I would do my goniometric measurements. I would do elbow extension and elbow flexion, and as you learn each thing, you'll be responsible for that on the test. Okay, so for this first test, you'll only be responsible for shoulder if you get a shoulder. Okay. Also, if she does have full range of motion, I'm going to check for manual muscle testing. Again, you'll be responsible for that as you test for that. Okay, so then we would test for her elbow flexors and elbow extensors to make sure that they are normal strength. Since we do have an empty infill and don't have full normal range of motion, we're not going to manual muscle test her because she does have pain. Okay, so her infill would be what? Empty. She does have an empty infill. Okay, so what would you say on a scale of 0 to 10, with 0 being no pain, you're at the beach, you're all just happy chilling, 10, I need to load you up in my vehicle, run you to the emergency room because you can't function.
I'd say a 6.
Okay. What makes your pain worse? Is it movement? Is it sleeping on it? What are the things that make it worse?
Playing tennis,
Playing
movement.
tennis. Okay. So at night, at rest, you think it tends to not be
It's
as
a little
bad?
sore, but at night, but it's worse if I'm moving it actively.
Okay. And would you describe the pain with those movements as sharp, burning? Is it a pounding pain? How would you describe that pain?
I would say a sharp when I'm starting to try to do the movements to play
Can you
tennis.
show me where that is the worst for you? Can you pinpoint that pain?
Right in here.
Okay. Well, that would make sense because that is where your muscle is attached. And so when you move those, that's where they're pulling on. Okay?
Okay.
So next we're going to do what's called a dermatome test, and we want to look and make sure your sensation is intact for this test.
Okay.
That may be something they did not do for you when they did your hip, and I'm really, again, sorry about that, but we don't want that to happen again to you.
Yeah, that poor
Okay.
student, she was really upset.
I'm sure she was. So we wouldn't do a dermatome test over your skin, okay? Because
Okay.
we're looking at that sensory distribution of each nerve root to make sure that it is doing its job and giving you juice to the area, okay? So I would always, I'm gonna put you in an anatomical position. I would always start with your uninvolved side first,
Okay.
okay? What I'm going to do is I'm going to touch you, I'll just touch an area of your skin, like
Okay.
that. If you feel anything, you'll just say feel it or yes.
Okay.
Okay, that's the only response you'll give me, is the response to feeling and the touch.
Okay.
Okay, we'll have to close your eyes because I'm trying to see that sensation. Okay, all right. Now, as I'm doing this, I wouldn't give her any prompts, but I'm doing this for y'all. Okay, as far as C4,
Yes.
C5,
Yes.
C6,
Yes.
C7,
Yes.
C8,
Yes.
T1,
Yes.
T2.
Yes.
Okay, I'm going to do the same thing to your involved side, and I want you to give me the same response if you feel it.
Yes. 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 Yes.
Okay, I'm going to do them together. Keep your eyes closed. Right, I'm going to do them on the same at the same time. If they feel the same, you tell me same.
Okay.
If anything different about them, say different. Okay.
Same. 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 Same.
Okay, so they are all the same. That means your dermatome sensory testing is normal, so you're a good candidate for this treatment. We've done all of your pre-assessments. Okay, so let's bring you over here to the treatment area. Now, you said you didn't have any cardiac or heart conditions. If so, we would probably take vitals also and do a pre and post for those as well. Let me do, I'm gonna turn you this way a little bit. Still. Alright, so remember we check this area, okay? What we're gonna do is clean the area for you. Do you have any sensitivity to alcohol or cleansers?
No, ma'am.
Okay. If you did, we would just use washcloth and soap, so you wouldn't have any type of chemicals on you. Right. Probably would have gotten a towel to make sure. I do have a little towel. I don't want any liquid because that can increase conduction of my electrical current. Okay. And these were never used. Oh, those were Haley's. No. So we're gonna do, we wanna get maximum polarity results here. So I think I'm gonna do a monopolar setup. So I'm gonna put my proximal one up here. down here, right over the area of the pain. So I'm going to go right here. Make sure that I have good contact. This is where you identified as pain. These are right there. If this didn't have good contact, I could wrap them further. I'm going to come here with my larger electrode, and that allows for my stimulation to go into the area where you're having pain. And I'm going to take this one and I'm going to put it up here away from the area. Make sure we've got good contact with the skin. Okay, does that feel okay to you?
Yes, ma'am.
Okay. All right, so let's get this machine set up. So we're doing a high volt. So we're going to go here into high volt. And we want to make sure that we are set up. Okay, so here is our active, and this is our active one right here. We are treating you for acute pain. So we want to try to get some positive polarity because that is really going to help us with the acute pain the best. Okay, good contact there. You feel comfortable here. Got the pillow here. Do you want another pillow for this extremity?
No, ma'am, I'm
Okay,
good.
very. So positioned correctly, do you feel like you need to be draped or a blanket or anything like that?
No, ma'am.
Okay. All right, so we're gonna go here with high volt. Make sure that our high volt channel is here. And we are gonna go with our rate. And we wanna go, I'm gonna put about 100 for our rate. That is our frequency. Again, that is going to allow you to have just a pleasant little buzzing, nothing that's gonna burn you or hurt you like before. And we're gonna keep that at a solid 100. Okay, and we're going to do a positive polarity, continuous. Ramp doesn't matter. So we are wanting to do our time. I go back to time. Okay, so you could do a high rate for up to 24 hours. Of course, we're not going to make you sit here for that. So we're going to set you up for 30 minutes here. Okay, and we'll start turning the intensity up. Now, what you should feel is that slight buzzing, that little bit of like ants crawling, but no biting, no burning.
Okay.
Just let me know when you feel anything.
There.
Okay, what are you feeling?
Just like you said, just a low kind of.
Okay, but not too intense.
No.
Okay, can I go up just a little bit?
Yes, ma'am.
Okay, right there?
Perfect.
Okay, all right, so what I'm gonna do is I am going to leave you with a call button.
Okay.
Here's your call button.
Thank you.
All right, you just click that. If you feel any burning, increased pain, anything different than this right now, you hit that horn, okay? I'll be back to check on you in 5 minutes.
Okay.
It's been 5.
Okay.
Okay, how are we doing, Miss Audrey?
Great. No
Okay,
worries.
any pain, increased
No, ma'am.
pain? Okay, still the same sensation. I'm gonna check your electrode contact. There's no redness around the electrode. Everything is connected appropriately. You haven't messed with the machine, right?
No, ma'am.
Okay, everything is good on the machine the way that we set it. Okay, so we've got about 25 minutes left. So you've got your call button if you need me. Okay, I've also got, there's a tech sitting right here in the next room also.
Okay.
Okay? Treatment's over. Hey, Miss Audrey, how is it? Your treatment is almost over, so we're going to go ahead and turn your intensity down so we don't have any surging going on. So we're going to go all the way down to 0 on our intensity. And I'm going to go ahead and stop our treatment. Okay. Now, let's go ahead and remove these from you before we take the electrodes off. It's a nice tight fit there.
Yeah, it is.
Good grip strength. Okay, Tracy.
Well, it was hard to get on there too.
Okay, I'm gonna just
Do
ease this
that.
off.
There's more than
There
one
we
way
go.
to skin a cat.
That is right. I'm gonna be very careful. I don't wanna hurt your skin here. I'll put these back on their little things. And we'll put these back for you to use on the next treatment, okay? How are we feeling?
Good, perfect.
Okay, so give me that scale again. On a scale of that 0 to 10, the same parameters, do you think?
Wow.
What would you say?
I'd say maybe a 2 now.
So you think there's been an improvement then?
Yes.
Okay, maybe we've got some enkephalins that have been released now. Okay, so let's do some of our post assessments. We've got a little bit of redness over the electrodes. Now let me tell you about that. That could stay around for about an hour.
Okay.
Normal reaction under the electrodes.
Okay.
If it persists beyond an hour, you're going to call me or text me.
Okay.
Okay. If you start to feel any soreness, increased pain, burning, those are not normal. You let me know right
Okay.
away.
Okay.
Okay. So we've looked at pain. We checked the area. We would reassess for goniometry, manual muscle testing, circumferential if it was edema, check a wound if we had a wound. Okay. Do you have any questions about your treatment?
No, ma'am.
Okay, so I document my parameters, my time of treatment, and do my second note.
Boom. Just like that.